it's Chili Rose here, and welcome back to my ER. Today we are going to do some arm surgery. Some girl broke her wrist or something, I don't remember. But let's operate. Uh-oh. Quick! We've got a patient in the ER! Here she is. I've looked her over and her vitals and responses are all normal. Oh no, her face. She does have a bump on her arm, so I'm going to give her an x-ray. Wait here, I'll be right back. Oh no! I tripped on my way back and all these patient files got mixed up! Damn it, Laura. Okay, realistically, how would you know? Well, I guess these are legs. Alright. How should we treat her? Surgery, of course. Okay, if I remember correctly, it's the medium one? Yes, it is! Alright. That sleeve's gotta go before you can operate. But, can't you just roll up her... Oh no, this will get infected. Scissors. I'm sorry. Alright. Use the tourniquet to minimize blood loss. Alrighty. Put it on our arm. Turn that bad boy on. Yeah. Alright, sterilize. Tongs and cotton ball. Here we go. Whee. Uh-oh. Her vital signs have suddenly dropped. Alright. If we aren't done in 5 minutes. Oh, the pressure. Okay, the scalpel. Here we go. Oh! Yeah! Ouch! Ooh! Okay, bleeding, no problem. Cauterizer, bink, 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 bink. Okay. Use the clamps to open the incision. Oh boy. Woo! Okay, get that, no, fuck off. Get the string. Yeah, string. Move that nerve. Ouch! Okay, look at all these bone fragments. Grab the tongs. Get these fragments out of here. What did you do to your arm, girl? Wait, what? Careful. Perfect. Alright, we're doing good on time. Fix the fixation plate. I gotta screw that in, right? Get the drill. Ouch! Ooh! Ouch! Ooh, that hurts. That hurts me as much as it hurts you, girl. Is this the only patient without a name? Okay, insert the screws. I wouldn't want to have something metal inside of me. Drill? Screwdriver. Ouch. Ouch. Ooh. Ow. Ouch. God, this hurts. Close up the wound. Okay, we're done. Oh, I like the way the string moves. I gotta. That's fun. Okay. Yay! Another patient saved. And probably the only patient in this series who doesn't have a proper name. Alright, next up, we're gonna do knee surgery. This little guy here, he fucked up his knee skateboarding, I think. So let's fix him up. This is Steve. Steve fell while trying to perform a stunt on a skateboard and landed on his knee. He's in a lot of pain, so we'll need to check his knee for potential serious damage. Let's get an x-ray. Alright, this looks like an x-ray. Yep, okay. Turn that bad boy on. There's damage on the... Ooh, is that it? Is that it right here? Ooh, yikes. Operation. Yes! Okay. You gotta shave your legs. Is this one of those operations you would be awake for? Yeah. Come on. There we go. Alright, apply antiseptic. The bane of all Jacksepticeye fans. Well, I guess that's antisepticeye. Anesthetic. Ouch! Oh god, that one hurt. Wait a minute for it to start working. Alright, right, let's do it. Make the first incision. Just a tiny little cut. Blink. Okay, the what? The cannula? Saline solution? Ouch! Okay. More incisions. Okay, a little cut here and a little cut here. The arthroscope. Ouch! Okay, I got focus. So that was focus. Yeah! Okay, yep, there's the torn piece. Hook scissors. Woo! Looks like a crab claw. Now let's get that piece out of here. Bye! Okay, yep, smooth it out. There's the rasp. Oh! Oh, that sound! Okay, remove all the equipment. Suture. Stitch them up. Just one? That's not gonna do the trick. Adhesives. And bandage. I'm sure the patient will recover in no time! Was he awake for that whole thing, or was he out? I'm not sure I want the answer to that question, actually. Alright, last one, nose surgery. This was actually the first kind of these games. This is the first surgery game I saw, was the nose surgery. Something's wrong with her nose, so we're gonna fix it. Your patient Ashley is experiencing breathing difficulties due to deformations in her nasal cavity. Today, we're going to surgically reshape Ashley's nose to improve airflow and resolve her breathing complications. We'll also give her nose more aesthetically pleasing shape. Alright, Ashley will be fully sedated. Yep, anesthetic. Go her nose, wait for her to fall asleep. And she's out. Alright, let's do it. We're unconscious for a couple of hours. We can proceed with the operation. Okay, the what? The retractor. Okay, the incision. Here we go. Ah! Use scissors. Okay. 5 minutes. Ouch! Cauterizer. Okay, a second incision to reveal the septum. Scalpel. Yo! Is that what that is? The septum? Alright. Ew. Shorten it. Tweeze. Oh. Ow! The scissors. Ah! Okay. The aesthetic part, okay? Osteotome. Oh no! 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 Ow! Ah! Ooh. The tweezers. Get that out of there. The rasp. Ow! God, this hurts. Okay. Close the open space left by the bone. Osteotome. Again? Not again! Ow. Ow. My nose. Okay. Reposition and close the open space. There we go. We're almost done. Pick up the needle. Yeah, we are almost done. Ooh. Ow. Oh, this makes my nose feel weird now. We're almost done. The needle, suture that bad boy. Airway splits. Good work, doctor. Thank you. Nasal split. And bandage. Yay! Your nose job is complete. What the hell happened? Why are your eyes purple now? That's a mystery to be solved for later. That was another round of surgery games. Okay, realistically speaking, and I said this in Surgeons in VR, I thought I wanted to be a doctor when I was little because I've always been interested in how the human body works. Surgeon Simulator isn't really about that. This is. These Operate Now Flash games. These are about realistic procedures and how they're done. And more of those coming soon, but for now, thank you guys so much for watching, and I'll see you weenies next time. Anyway, that's how I lost my medical license.